all about doing that one thing right. You start seeing results. The result gives you the encouragement and motivation to do more, and that's where everything happens. And that's where consistency is very important, which Dr. Senthil is going to was talking about, and I'm also going to talk about the same thing here. Okay, so I'm not only going to talk about the Ophthall references, I'm going to talk about some other hospital references also, so that our views and our directions of thinking is all, from all angles, we get to see that, there's an evidence to what we are talking about. So today we're going to focus more on the clinic, and the personal branding of the hospital, personal and the organizational branding as such. So we're going to approach this in various different ways. I created a format called FCR, and I'm going to also talk about this format and how this format can be used basically to understand things better and take things forward. If you think there was an article which spoke about the violative categories in the healthcare advertisement. Sir was talking about the bicycle advertisement and all that, and there are a lot of places, where healthcare brands are today advertising. In fact, the most advertised brands in any regional space as such is, is a real estate company, and then there's a healthcare company, because these are very regional businesses. And there are these actually fight for the real estate of the advertising space. And if you see healthcare, they say that, out of so many advertisements that this report came out by ASCII, 1,569 ads were violative. And there are a lot of conditions basically based on which they say it is violative, and it is all out there. But just I wanted to point out that, this is the case basically. And then when we see that there are a lot of people who come out on the social media and talk about health and financial information, even though they are not qualified, and they call themselves as influencers and they talk about it. And there are a lot of strict guidelines basically, which say that, you're not supposed to talk about it. And that gives furthermore encouragement to those who are qualified to talk about it. Supposing someone is just like that giving advice relating to eye, how to protect the eyes, versus an ophthalmologist talking about, giving an eye advice. So basically, there is a lot of scope for doctors who are qualified in the respective specialization to talk about your core area of specialization. And these people who are talking about, giving health advices, are just going to vanish? It's going to be much more stricter. They're going to be under very strict scrutiny. So it's not just going to be that easy. And also, it goes on to say that, celebrities, influencers, virtual influencers, there are a lot of characters being created through Ghibli, and there are a lot of other tools, basically, all 3D characters, virtual influencers, digitally created fictional characters are now obligated to provide clear disclaimers if they are presenting themselves as health experts or making any health-related claims. So these things make things much more stricter, and there are a lot more things happening in this space. So whatever I'm going to talk about is in healthcare marketing, it's all about going to be the awareness marketing. So there are a lot of things which are happening not in alignment with what is supposed to happen. A lot of wrong things are happening, and a lot of cleanup is going to happen. And there are people who are also getting quick popularity because of using some shortcuts. And if you think, that is the way to go forward, in fact, that is going to be wrong, and it is going to be heavily scrutinized. A lot of people are going to be penalized for it. They may even be put behind jail, because the things which came out in the newspaper were very strong, and it is very much under scrutiny. They are under scrutiny. It's not just going to be so easy for people to make fool of others and just pass on the information going forward. So whatever I'm going to talk about is about awareness marketing. I'm going to talk about the cost-based marketing, and we are talking about only ethical marketing. So the tools may be through your physical media that you're using or the digital media that you're talking about. The ethical marketing is going to be here, and it is going to stay. There's going to be no problem at all for you to follow these methods. And this is completely safe for you to approach your healthcare branding and marketing, whether it's a personal branding or your organizational branding, through these different ways that we're talking about. When I talk about ethical marketing, what am I talking about? So as per the National Medical Commission, the draft which was released, and which will soon be implemented, and there are few protocols which they have laid out, based on which you can actually talk about, create communications in the mass media as well, which could be a RMP is permitted to make a formal announcement in any media on starting practice, change of type of practice, on changing address, temporary absence from duty, resumption of practice, succeeding to another practice, public declaration of charges. So these things, even though all these things are given, in black and white, very clear, not many people are using it. There are very few corporate hospitals who know how to use it, and they're really leveraging on this, method. Say, for example, it'd be bringing a renowned doctor added to your panel of doctors. How many hospitals or how many centers actually talk about them being added into the into your core team? If you see, there are few hospitals that I've been observing, who make a big announcement because it's allowed, it's permitted to make such an announcement. They make an announcement. The moment the announcement is made, there are a lot of followers of those doctors who get to know about it, and then they start following the doctor here. Even otherwise, they get to come through the references, or they get to connect with the doctor, and then they come through this. But making an announcement publicly is permitted in certain cases, and leveraging that actually can, help you develop your brand in a much higher level. So think about these areas which are already there, and not many are using it. And many of you not even know the kind of a qualification that your consultants or your, the panel of doctors that you have. Talking about them in your social media, in a lot of other spaces actually can get you the kind of leverage that you want. And there's another quote from the same draft, which says RMP is allowed to do public education through media without soliciting patients for himself or for the institution. RMP is allowed to share educative material for the information of the general public. However, the communication should be limited to the expertise of the RMP. See, there is one very clear thing in all these guidelines that we see, and there is going to be no restriction about it, and that is only education, education, education. So I keep talking about education in all my sessions, more particularly because this is the foundation of everything. Today we may talk about lot of marketing metrics, lot of things, different format, but there is one thing which is never going to change, and this is going to set everything right in your marketing for the education. So if education is given clearly from your side, conversion is a byproduct. There are days like what Dr. Sendil was talking about. If Dr. L.V. Prasad was to start today, like, will he be able to build such a big institution? Gone are the days. There are days like when even the big people, through all good work over the period of time, only they are known basically through the word of mouth spread and everything. Today, even if there are some very good talented people who don't have such huge practice number of hours put in practice, but they're really good and they have the real right thought process, they can actually be very much famous. They can very much be known to people at a large scale through the right education formats, which we see. There are a lot of people on the social media using. I'm not saying all of them are using the right format, but there are a lot of people who, through education alone, have become very, very, very famous. And not only regionally, nationally, even internationally, they are well known. And at the same time, this has helped them to improve their practice drastically. And we know there are some doctors who have increased the number of cases, the surgeries that they operate through the familiarity. Why this education? Why are we talking about all these things? There is only one thing which is never going to change in the entire, the future or anywhere in the history. If you see, there's only one thing because of which people approach you. It's because of trust. People are going to trust you. They are going to come to you, no matter where you are or who you are. So if trust is to be built today and in the age of social media, then education is going to be your power tool. It's going to be your magic wand. And you as doctors, you have a lot of education, you read a lot of stuff, you are very much trained to give this education out to the world in the right way. So education is going to be your magic wand to get the conversions, and education is going to be your foundation for winning the trust. Doctor was asking about, there are people who are going out of the city. We get these questions every day in and day out. When there's a small region, there is a tier 3 location wherein they have the highest of the topmost technology being implemented there, but still it is very painful to see they going to the tier 2 or the tier 1 location for getting treatment. Why? Because one very important thing is that such technology such technology existing in that particular location itself is not known to people. There is lack of awareness. Second comes the trust, but the awareness itself is not there, then what's the point? So,
yes, sir, before you proceed,
yes,
I have a doubt, this is slightly off. Yeah, I see a lot of doctors because you are talking about the medical council guidelines. They kind of go on this Instagram in particular, and then they try to say that I have this smile technology, I have latest technology, and is it not soliciting? And Instagram rules, does it apply? This MCA rule, does it apply to Instagram? Or and even doctors performing a lot of things like they dance, sing, and everything. So how ethical are these? And are they? Yeah, please answer. Yeah, I think you're muted. Please, sir, you're muted.
Yes. So that's what I was trying to tell you. See, initially when you see these doctors, they started it all right. Later, later because of the fan following, they became very crazy. Started doing a lot of things, maybe just to to keep up the audience engagement.
Correct. So, is this permitted by the medical council or?
There is a gray area basically. Talking about soliciting a technology as such. There's a gray area that I think we also need some clarity on that space. Here it talks about soliciting patient, basically, telling patients that, come to me. That is definitely not permitted. Saying that this technology works is something that we need some clarity on that. Yes.
Please.
Yes, sir. So the framework, Shweta, Dr. Shweta, you there? Yeah. You want to ask something?
Yes, I have one question regarding technology. So, like, if we buy some new machine, so are we not supposed to like advertise it? Will it
Talking,
also considered as soliciting?
actually, there are two things. Organization saying that we have this particular machinery is different. Doctor saying that I have this machine is different. When an organization says that they have this machine, they have to say, because that's a very important value addition that you're bringing to your organization. That's what we are talking about.
What Mr. Elias says is if you have like a company, for example, say your hospital is already a company and that company advertising the technology is different from Dr. Shweta advertising that. If you are doing it as a part of the company, then it is okay. But if you do it on Dr. Shweta, then it might be considered as solicitation.
So, like, whatever post we create, it is shared on personal social media page as well as the hospital page also.
Yeah, so that is what in that post also, if you want to be very careful, what Elias sir says, it can be educative. You can say cataract is this and all these things. You can talk about cataract. If you eat food or you're wearing sunglasses, cataract will not come. But you should not be telling that I am a best cataract surgeon. You come to me and get operated. That is
That
the
is one thing. Another thing is that when you keep your organizations, keep it a little separate. Say, for example, when there is a promotion going on, for example, an iCamp is going on, you don't have to necessarily promote it under your page or under your banner. That happens under the organization banner. Unless and otherwise, the camp that you're providing is so, designed in such a way that is going to help people. And there's a lot of social angle to it. You're doing it with Rotary, and there's a lot of things around it. And such things can actually come under your page, provided there is no commercial or there is no commercial angle to it. Otherwise, it's better that all these things come under your organization page and there is no restriction there. And when it comes under the organization page, say for example, if you do some awareness videos, and along with these promotion posts coming out, if your awareness video also comes out with the logo of your organization, that is permitted.
Okay.
I think we'll go a little deeper now here in this, and then we will match it.
Before I forget, maybe I would also request Elias sir to address this because I have been now active on Instagram. A lot of things are coming.
I've seen you, sir. I've been seeing you, sir. I've been listening to you as well. Yeah.
So basically, I see a lot of doctors kind of dancing, a lot of doctors kind of doing a lot of gimmicks and tricks and all. So how do the patients perceive these? Let's say some doctors, because for the reach of his followers, he is kind of doing a lot of comedy. So basically, does the patient see that doctor is a serious person and we see him for surgery, or does the patient discredit the doctor? So where is the limit? Because I think many doctors get misled by the followers to have as many views as possible. and they kind of destroy their personal brand also on that whole thing. So maybe you can address on that point
Sure,
also.
sir, there are some doctors who have ceased to become practicing doctors. They have become doctor influencers. Their full-time profession now is not to practice.
But
They
is
don't want to engage with patients now.
Instagram giving them the revenues?
It's not only Instagram giving them the revenue. There are a lot of other benefits that they receive through the publicity, basically.
Mhm.
So their game is different. So which so that's where there is a line, like you do awareness education and everything is fine. When there are now these doctors that we see, they are full-time influencers. They have to travel because that's the format, that's the regimen they have to follow. This has become their full-time job. They have crossed a certain line of a degree wherein you can't consider them as these doctors who do content for practicing and do content, and they do content itself as a practicing component. That's the way how it goes.
That's I think Instagram doesn't give revenue.
Instagram does give revenue, sir. There are revenue formats for Instagram also. But apart from those revenue formats, there are various other revenue formats that they get basically through the lot of associations.
Okay. 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 Please continue. I think we are
Yes, sir.
diverted. So,
No problem. So first is focus. There are a lot of, I'm going to give you some examples from various different specialities. Just to see, like which one really catches up your attention, and if
Sir, sorry to interrupt you. Someone's mic is unmuted. It is getting disturbance. Like,
just
if some
1 minute. Is it better now? I think I muted one person.
yes, sir.
it's better, right? Yeah.
Please.
Yeah. So what I would request you to look at is just to see this is a case study, and can I actually make use of this? Is this case study somewhere that I can leverage? I also have something like this, but I have not been talking about it in this angle. Can I actually talk about it in this angle? If I can leverage it, then it is really something great, basically. Okay. First is an example. First, the case study of Professor Muhammad Rela. He's a very famous liver transplant surgeon, and he contributed to nearly,
Yeah. Please continue.
yeah, major chunk of revenue to the global hospital, basically. And then he started his hospital called Dr. Rela's Hospital, Dr. Rela Hospital, and Rela Hospital is now a very premier institution with a lot of activities happening. It started as a specialty center. Now they have centers of excellence all spread across and a lot of things. But if you see, there is one case study that really stands out, that built his personal brand, which helped him build his organizational brand. It is a personal brand here first that is very strong, because of which he is able to build an organizational brand. Okay, here is a case study of this lady who's standing here, 5 days old baby she was, basically 20 years earlier. And the liver transplant was done to this particular lady, and it was featured in a few international magazines about the entire story of what happened, and it's been so many years, and the person is really healthy. Dr. Kranti, I believe you may have to mute.
Yeah, I have done.
Yeah, thank you, sir. So one case study can actually build your brand reputation to a very great level if that one single case study can be presented well in the right way. Okay, so you see that actually became his core foundation. Even though he has done 6,000 plus liver transplants, but that one thing really sets his brand positioning very strong. That helped him build a very big empire today. Yeah, I'm sure that all of you would be aware, Chennai is a very competitive market, and especially in the healthcare space. Even though he was a late entrant into the space where all the big giants were sitting, still this institute is able to make a very great mark. He initially started with River as a Liver Center of Excellence. Now they are very much doing well with onco, heart, and there are a lot of other specializations. The idea is there are a lot of hospital owners who come to me, who start with a single specialization, and then they get confused whether to promote my multi-specialty or to promote a single specialty. One thing has to be made very clear that, your first core specialty has to be placed very, very strongly. That has to give you the necessary amount of revenue, the money to be generated for you to build several other specialties together. So that's the first thing that I just want you to look at in your book of case studies. Do you have any case study that is really, really remarkable, worthy of presentation, that can set your brand very strong in the brand positioning game? That's one. Second, the game begins with the name. Mr. Akhil was also there, I believe, met Dr. Balarajan a few days back. You see this doctor, orthopedic surgeon, he started a hospital, again, see, very recently started hospital, and 5 years back, I believe, 5-6 years back, and he started something called Onus Robotic Hospital. The name itself very clearly specifies the new niche focus. Today, when we bring a technology, we are, the name is still there as it is, and then the technology is brought in, and then we release the full page advertisement talking about, this particular technology launch, and people don't even understand what is the use of the technology. And then there is, a lot of communication support that needs to be given to really authenticate the claim, or, to give more evidences on that. But the name changing, bringing the robotics in the name itself is a game changer. So, Onus Robotic Hospital. So that was actually a game changer to make people understand the kind of robotic surgery done here. It does not mean they only do robotic surgeries, but by bringing that into the name, the brand positioning became very, very clear. And the organizational branding became very strong in a very competitive market like Hyderabad. Then what happened was they have now the core specialization. Dr. Balaraju's core specialization is orthopedics. So his only focus was knee replacement surgeries that he was able to do very successfully. And that niche is very clearly built with the name and the kind of services and the work they are doing. Apart from that, now they wanted to parallelly build another center of excellence. So they bought, they invested in some technology, and then they launched the program called Heart AI powered heart care. And they're actually competing with the big known brands there. They are very small brand comparatively, but through niche idea of focus, they are able to win the attention of people within the fraternity and public at large by bringing a specialist, and also by creating the program and launching the program. So in your organization also, if there is a technology, or if there is a program or a treatment technique that you want to talk about, and you want to create something around it, package it and call it, give it a name, that can actually become a unique qualifier for people to come and approach you. And if there is a lot of success which is going to be created through that program, and if people are going to see that, because of this, we were able to, get the kind of attention and the treatment and the desired results, then that program is going to be successful. In future, even now, if you really have to compete with big giants, you have to create your own programs. The programs need not only be a technology specific program, it needs to have a comprehensive package of things around it, which could be, combining your consultation, technology element is there. And then there are a few other components that makes this program unique. And your cataract program itself be called certain thing, and then you can, package the program, and then you can launch such a program. It is something that you've been doing it already, because everyone who provides a treatment, it is not, even though maybe, medically the outcomes are similar, but the way how you can approach and you can give a shape and form to it can vary, and that can really create the difference. Okay. The third thing is about Narayana Hridalaya, and I'm sure all of you are aware. And there are people who speak about, organizational brand, again, getting confused with, my organizational brand has a niche focus. And now I want to expand with a lot of other things. And how do I really do? Or I am known as only a cataract surgeon, but I also do these things. How do I really do? So here is a very classic example. You see that, Narayana Hridalaya Hospital. Initially, when you get started, there's actually no one going to, prevent you or going to stop you from, positioning yourself as one thing today, and then later on expanding it to few more things. There is a big, myth, I can say. There are people who get confused with deciding, I have to decide today what I'm going to do in the next 5 years or 10 years. That is never going to happen. That is never going to happen, because every day things are evolving. You are evolving more particularly. Your ideas are going to evolve. You are going to have a different thought process next year. So having one name for the entire game sometimes is possible, but what is more importantly needed is at this point in time, am I relevant? Am I impacting? Am I creating the kind of attention that I want for my brand, for my personal brand, for my organizational brand? That is more important. For that, you can make certain customizations and there is no one preventing you. You don't have to be so hard and fast with certain things when it comes to branding and trying to decide about these things now itself. There are a lot of examples of global brands who have done these adjustments and grown. So if you take this example of Narayana Hridayalaya Hospital, Hridayalaya, it says very clearly it is art focused. And now this brand is rebranded and they're calling themselves Narayana Health. Again, it has a lot of things under it, its umbrella. So an organizational brand having bigger things, and we already know the legend is there. And Narayana Health, the services are much more extended. So from a heart hospital, now they are an insurance provider, health insurance. Okay, so that there is no limitation to the way how you can grow. If your core foundation is strong, relevant at the time when you are actually doing things, you are going to grow drastically. Later on, as you grow, you keep increasing the definition of what you really stand for. And we see some doctors, doctor was also talking about, comedy and all that, but one thing I would like all of you to, look at this thing more particularly, even though he's a gastroenterologist, he speaks about, he has taken this one thing very, very seriously throughout his entire communication, gut. So the entire gut health is what he talks about, and there's a very big market which is now created for gut health, as you all know. So even in your area of specialization, instead of being a general ophthalmologist, I want you to focus on one area which you can only start talking about it, in the initial phase, which can really attract the attention. Later on, you can talk about the various other aspects revolving around it, and that helps you. That actually sets you apart. The algorithms, the search parameters, whether it is AEO or SEO, all things are going to be favorable to you when you're going to have a niche focus on one particular area. Okay, so there are a lot of followers that this doctor has. And one very quick information that I would like to give all of you is that if you want to become overnight famous, it is very much possible in the social media, provided who's going to be with you in your video is going to be very important. Now you see these doctors, they have a very clear exchange of audiences that happens when Dr. A here has Dr. B, or say for example, Dr. A here has Dr. B. When both of them are talking about a topic, basically, so what happens is he has got a lot of followers in the social space, and he has got a lot of followers in the social space. And when these two people come together, and the audience here who are going to like him are also going to follow him, and here those who are going to like him are also going to follow him. So it is an immediate audience growth that happens through the collaborative network that is built. Another day, I saw this doctor, Dr. Paul, talking about one orthopedic surgeon in one of his LinkedIn posts, wherein he was congratulating that doctor. The doctor was from Tier 2 location, saying that his father's knee replacement surgery was done by the other doctor, and he shared some very good views about the way how the entire thing happened, and he started talking something about the ortho stuff as well, and that got recorded into a podcast. That immediately made the other doctor, who was really famous, but very regionally famous, made him international famous through that one single post which came out actually. So you as doctors, you already have a lot of contacts of other doctors who may be famous, or people who are from the non-medical space who want to understand more about the medical area that you are specialized in. Having a collab video like this can give you the instant publicity. Overnight publicity is possible today. It's not a myth. Only through some directed efforts that can happen through the collabs that can be worked out for you. It's a simple thing. I have seen many people become successful only by following this simple formula. Later on, you build your content and all that. That is going to take a lot of time. Okay, but this can give you the instant success guaranteed. Along with that, you have to keep building your own format of success of bringing the content. The idea is very simple, like when all these heroes came out individually and acted, the box office collection was very less. When they all were put together into one particular movie, so we wanted to see all the heroes in one movie. So it really is a big saver for us. And at the same time, it was a good collection for them. And the collection kept increasing as the thing. They kept coming with a lot of Avenger movies basically. And also same is the case you see in a lot of movies today. Instead of having the one big hero, now they have several other big heroes also coming as side actors, so that the movie gets to enjoy the merit of seeing the other big heroes in the same movie, and that gets the popularity from the other regional audiences as well. That's very important. So you get new audiences when you add new flavors. And these audiences, you will never be able to touch these audiences without adding this flavor. So these things are going to be the quick hacks for you to look at. And I'm sure all of you as eye doctors would be aware of Dr. Rahil Chaudhary. There are things that he does, maybe few things that I want you to look at when you are trying to do some campaign. He did this thing called World Eye Donation Day campaign, wherein he took a Lamborghini and a lot of activities were done. There are things that people agree with him. There are things that people don't agree with the way how he does things. But what I would suggest you to look at is, when you have to do certain promotions, some awareness campaigns, one thing has to be made very clear. All that money which was spent on the entire campaign was not from him. It was spent by the pharma companies, from the devices companies who supply things to him. And there are a lot of pharma companies and devices companies who have the budget for public awareness. Okay, they have huge budgets, but who is going to utilize the budget? Those guys don't know how to utilize the budget actually. They actually don't put the budget to the right, because they don't have the right vehicle, the right person to really spend that money on. If the programs are created regionally from your side, some innovative programs that can attract the attention, which could be in any way creative that you can come up with, I think these budgets can be effectively utilized, not only to create the public, awareness about certain things relating to eye, but also it is going to be a strong vehicle for you to do your personal branding in a way, and also a strong vehicle to build your organizational brand as well. Because your organizational brand can also come as one of the brands supporting the particular cause. So the money can come from one side and actually can be put to use for better purpose, in which way your personal branding and organizational branding can actually happen. We tried this formula in one of the organizations, and let me check if that case study is here, wherein the brand wanted to do, sorry, sir.
Actually, I have been trying to collaborate with Rahil for my Instagram reels, but he's not accepting the collaboration.
You have to talk to him once, sir. I think you have to talk to his father. I don't know. Okay.
See, now we have around 30-40 people. Each of our target audience are very different. Instead of posting the reels individually, we can collaborate with each other.
Very, very simple, sir. And those who have already got good number of followers, we start the collaboration. The kind of reach is going to be phenomenal. It's a very simple hack. Okay, so what I was trying to do is, I wanted one of the orthopedic hospital in a tier 2 location to launch their brand. And as usual, right, all their money was spent in getting the hospital ready and the equipment set. So they wanted some innovative idea through which they can get the brand promotion done, but not in a very commercial sense. Because what happens is, the moment you launch a new hospital or a clinic, you just put an advertisement and it looks actually very commercial, wherein you say that now the hospital is there. Unless and otherwise there is no hospital in the location, then people really feel very happy that there is a hospital there. Okay. So what they did was they wanted to come up with this concept of brand awareness, but in a very, very awareness-oriented style. So they created we created a concept for them wherein they have to, the people on that particular location were supposed to do a marathon on a particular day, and then the entire brand was having a theme. I think I have that in my subsequent slides, which I'll show you. The entire theme was talking about living an active, healthy lifestyle. So it was not at all talking about the hospital brand at all. It was only talking about the theme of that particular region. So the theme of that particular region was circulated all across. It so happened that a lot of brands not relating to healthcare were coming forward. A mobile phone guy, a textile showroom guy, a jewelry showroom guy. All these brands wanted to get attached to that particular theme. Yes, we want to live a very active lifestyle, in this particular region. And then that became a movement. And the entire program was designed and coined by the hospital brand. In the first year itself, they had a very huge traction, and then they started doing it year after year. So by spending, actually, when I asked the doctor, like, did the idea really work? What was the real output? They really had to spend some 15 to 20,000 rupees, if I'm not wrong, that too only for supporting one radio channel to a very least degree possible. The entire money which was required for was some 5-6 lakh rupees, and they did not spend one single rupee on that entire promotion. The 5-6 lakh rupees was generated for the entire program from the general brands, from the brands outside who came as sponsors supporting the entire event. Imagine, even at a regional level, there are a lot of other brands who want to talk about health, who want to connect themselves with the things relating to health, because they want to show themselves as a very socially responsible or a regionally responsible brand. And health is a good coin to play with. You would have seen this video wherein he talks about going from Kashmir to Kanyakumari in Lamborghini. But just to cut the long story short, that was the idea. And there's another example that I saw, going forward, there are some brands who are adopting it, and going forward, this is going to be the way, to look at business. If you are going to look at, you are competing with one eye care brand, competing with another eye care brand, just you have to rethink about it, the way how you are doing business. Today, it's all about creating a brand. The brand has a clear-cut guidelines and the format of working. And the brand, the eye care brand that you are developing, can actually operate standalone, or it can operate inside another hospital if that is possible. Because this example of Sipaka, they created a model wherein there is a multi-speciality hospital, and then there is a emergency department which is taken care by Sipaka. So the infra is provided by the hospital owner, and the entire running of that ICU is done by Sipaka. So it's like the hospital name, and then along with Sipaka ICU, that becomes the co-branding. And I have seen such formats work in a lot of multi-specialty hospitals also, wherein the fertility center alone is now managed by this so-and-so brand, powered by so-and-so brand, and it is operating in this particular hospital. Likewise, I see there is a very big scope if you are also going to think in the similar lines that, instead of putting up everything on your own, if your branding is strong, this co-branding can actually take things to a higher level, because there is going to be a captive audience that is going to be there with the hospital. And if the eye care solution is going to be provided by you, then I think is another way of looking at things. This is a very nice video that I saw. This Sibaka brand, they did it. Just enjoy the video. Don't ask me any questions relating to it. That just to show in the way how they have standards when it comes to the care part of it. And then the another case study which I saw is very interesting is this one, wherein a small hospital, basically through a niche positioning that they could have, they can claim as themselves as the the first in that particular category. This is an example of in-house Medicare. They have a few centers that takes care of home health care, and there are a few services relating to the elderly care that they provide. And they came up with a hospital, I believe some 50-bedded hospital in Coimbatore, and they wanted to be the first in the category. So Coimbator's first elder care multi-speciality hospital. So if there can be a niche, the way how you can arrive at positioning yourself, then definitely that's a right thing to look at. Now this $1 million question of organizational brand versus personal brand, what is the right way? And I believe what I've been doing so far, I believe Dr. Arun
highlighted wall bag of
Dr. Arun, you may have to mute, sir. Sorry, I don't have the access to mute.
Yeah, please 1 minute. I'll just mute him.
Okay, so
तो भी चलेगा सीखा है तो उससे क्या है कि वो खुला खुला लगा है घबराहट नहीं होगी वो छोटा जगह ओपन में
Arun, you may have to mute, sir. Sorry, I'm not able to mute.
दिखना चाहिए
Yeah, please give me 1 minute.
Yes, sir.
अरे हम लोग का वहां पे ही आर्टिफिशियल सीलिंग
Yeah, please. Yeah.
Okay, fine. Okay, organizational brand versus personal brand. We see big organizations, talking about a lot of things, and And then you also see some, organization that comes to limelight, which not many people outside the region would know. And there is a birth on the go, doctors providing services. There's a KSRTC bus that turns into a delivery room in Kerala. And that hospital becomes overnight famous, Amula Hospital. And then we see there are doctors who are personal brands and who create a lot of formats, like Was and Safe is a format created by Dr. Ladi. And then we see also doctors who became famous, just again, overnight success, I can say, of this Dr. Govind Nandakumar, who leaves his car, wanted to attend a very crucial surgery, and he runs 3 kilometers to beat the traffic in Bangalore, basically. So the idea is that personal brand and organizational brand, both are very important, both go hand in hand. And it is not that, you focus on only one thing. Basically, it has to be both the things together, because both the things complement each other. And there are some factors, basically, when there are people who talk about, when you show yourself way too much, and then people dependency on you is very high. But in fact, today people are also mature. They just want to see you, and then they, even under you, whoever is there, they are ready to get the services. That's the kind of a format which is now built. This is a report which came out by Grant Thornton in the support with the AHPI. This spoke about the kind of investments that have happened in the year 2022 and 2024. The healthcare investments are happening at a big scale now. The kind of deals which are getting closed in Bangalore, Mumbai, several other places, mergers and acquisitions, private equity, the FDI kind of investment, IPOs are very, very huge for the healthcare brands. I believe this is the era of, healthcare brands getting huge investments, huge funding. So branding at an organizational level. And we see there are a lot of hospitals and which are also getting the kind of also into the limelight, of getting the investment, basically. These reports will also help you understand how the brands are shaping themselves. It's not just about building a big organization. It's also building an organization which is really financially, brand-wise, really healthy, saleable in a way, or worthy enough to get investments in a way. You see this, there's an organization here, there are organizations here, there's an individual here. So gone are the days to speak about one person, one organization. So one person, there can be multiple organizations. We know this individual only through the one company, the Microsoft software. But what we also need to know is, there is an individual brand of Bill Gates, which is built separately, and he keeps on making investments. Maybe sometimes you can see that his individual brand itself has got more equity, which can be bigger than few companies, the big companies in the world. On the other side, he has also got a portfolio of things around the brand that he's building simultaneously. So there's an organizational brand which is growing. At the same time, there's an individual brand which is also growing, making the organization more powerful on one side, organizations making the individual brand powerful on the other side. So you see this another example of, Mukesh Bansal, who sold Myntra, and then Ankit Nagori from Flipkart. They both came out of this company. They started this brand called Cure Fit, Cult Fit, and all that, which is now a very big chain. This is a brand which has got, which in a very, very, very short duration became $1.5 billion brand. How is it possible for any brand to become such a huge success? The format is very simple. When Mukesh Bansal was able to sell Myntra for a few, 1,000 crores and come out, and the investors are actually looking at him much more closely on his next bet that he's going to make, and where he is going to put his monies, or even if he's not going to put his money, where he's going to be in, what is the next move, basically. Wherever he's going to go, there the money is going to flow. It is the personal brand which is building an organizational brand here. And when the organizational brand becomes successful, that also helps in the personal branding in a way. What I'm trying to say is, think of both the things complementarily. Don't compromise one for the other. Both can actually grow, and both can actually complement each one's growth. So, Zoho on the other side, we see.
Can we take some questions like?
Yeah, please. Yeah.
Are there any questions in between? Are you following? And is there any questions? We can take up 1 or 2 questions, then can go ahead.
May I?
Yeah, please.
So
After Kalyan.
regarding you said you focus on one core specialty, but many a time there are two or three which are, quite relevant and equally valuable. Like now, suppose we are focusing on cataract, but we also have pediatric ophthalmology services which are, very relevant and useful. And even the LASIK or, all the laser refractive surgeries. So these are three different things. One is, what I have realized is, if we focus only on pediatrics, sometimes it hampers your general ophthalmology perception. But then you want to focus that also. And again, if you focus only on cataract, shall we not focus on the laser refractive? So how do we keep a balance of these two or three services which are our core offerings? Thank you, sir.
So when there is an organic, sorry, so you want to answer the doctor?
No, sir, please, you can continue.
So, Dr. Kalyan, basically, if there is an organization and if you have, 2-3 specialists who are represented. So, are there any questions? Basically, I want to stop with one part and then, first was the focus on it.
Yes, sir. There is one question.
Akhil, are you there? Akhil ji. Okay. Yes, sir, you can start your question.
Yeah.
Yes,
So, sir,
here only.
Yes, Akhil.
so many of us are in this PDP group. I think many of us are solo practitioners, and the patients usually they are coming for that particular doctor only. So do we need to do a personal branding or our clinic branding, especially when we do not have an immediate plan of expansion of hiring other doctors? So should we continue doing a personal branding or a clinical branding?
You want to add that? Say
I
something.
want.
Yeah, yes, sir. Okay, both of us.
Yes. Akhil.
Okay. I need to add. Okay. So to be very frank, in my practice and my opinion, we should focus on a personal branding, and simultaneously we should collaborate with the organization. So basically, we should have a two platforms. So Instagram, you have an Instagram, Facebook. So you should have a two platforms. And you should post it on a personal branding, more kind of, like personal handles, more kind of a personal things, which is more kind of, your daily routines, you are going somewhere, your ideas and all the stuff. And on organization side, you put mix of content, the content pillar we talked about in the first session, that content pillar you use for an organization. But I think, yes, more you should leverage your personal branding, because you are not planning any, future nearby kind of, expansion or organization growth or anything. And because organization branding, if you keep it along with it, so it will leverage both the things in future.
Yes.
Got it. Ilyas, sir, your views?
Yes, sir. So personal branding, organizational branding. Yes, personal branding is a very easy take for you because as a person looking at you, only people are coming in and around you. Another thing that I've seen is those who are solo practitioners who are also producing content, they become instantly very much, superstars in that particular core specialty for that particular region. Because once your people start seeing you, the next is the Gen Z I'm talking about, they start seeing you in the social media also. Yeah, this doctor is also there in social media. I've listened to him and all that stuff. That adds to a lot more credibility part of it, and that immediately catches up the attention of people. They build trust, and if they already built that trust, it also helps them to start following you on the social space as well. But as you're trying to do this, as Akhil also said, start building your organizational brand also, because there are certain things that you do as an organization, you cannot bring it under your personal branding profile. Say, for example, if you're conducting a camp, you're conducting certain things at a reduced cost or whatever, basically, those things can be very well promoted under the organizational banner. And also, as you start growing in your, ultimately, people will want to approach you through your organization only. They can't just like that approach you, right? So there is ABC clinic or ABC hospital through which they can approach you. That's how it happens. The appointments are fixed. So as you start growing in, your organizational branding also starts happening through you. And later on, the organization itself creates its own identity through the work that they do, the kind of infra that you add, the kind of things that gets shaped up in the organization, and because of which it really, was a very good thing to look at. It's a
I just wanted to put one disclaimer over here, because in my practice, you won't believe, recently I was in Hyderabad, right? 2 days I was in Hyderabad with the Dr. Balarajan Naidu, and you won't believe, I'd say stop doing your personal branding. So there is, case to case, we need to understand the
Exactly.
requirement of the market, requirement of the hospitals, and then you need to do it. Because what is happening is they are going towards the multi-speciality, and his brand becoming more than, organization. So in this case, I need to stop that thing and create a, more on a robotic hospital, because we need to survive the other hospital, other doctors also, other departments also. So that way, case to case, I think we should not put the, Lakshman Rekha kind of, this is the rule. But yeah, case to case, we can definitely evaluate that thing, and we can come up with the, idea whether we should leverage the personal brand or organization brand.
Great.
Yeah,
Any
continue.
other questions?
May I ask?
Yes, sir.
First, I have an observation to mention about Akhil sir. Today, the white shirt person is in grey t-shirts.
Sorry, sir. Sorry. Actually, I haven't.
No, sorry, it is just on a lighter note. See how
Yes,
the
sir.
brand affects. No, you are always on the white shirt with all the.
Absolutely, absolutely. So you missed that part. Actually, starting only, I said, today I am not at all in mood. I am into ekdam relaxed mood. So
Acha,
I'm
acha.
wearing the
We
white.
You
we
perform
dragged
better
him
in relaxed
today. We forcefully dragged him in today.
Acha. Acha, one more point, sir, regarding the same question, just to add on to the or continue with that. Like
Yes.
we have 2-3 important offerings, but it's like Dr. Amit said, most of us are single or solo practitioners doing that. So there are no different doctors doing different specialties in the same premises. So how do we go about it? If we have 2 or 3, good offerings, and uh, if one of the offerings is trying to, affect the other, but we have to offer all. So how do we go about it, and how keep a balance?
Do you want me to add?
Yeah, please start.
Basically, you are talking about the, the various specialty or various offering kind of a thing?
Yes.
Or-
Suppose we are into it is predominantly a cataract practice,
Okay.
uh, catering to all types of cataracts and all types of the best of the IOLs and all.
Right.
Second thing is the laser refractive surgeries for spectacles.
Got it.
Not only laser but any other surgeries also lens based. And third is my super specialty pediatric ophthalmology and squint.
Right.
So we cater to all these specialties. But then how do we, since the person is same, the premises is same, but we want to promote all of them. So how do we do?
Definitely, we in very first session only, we talk about the content pillars. So you need to divide your content pillar in such a way that it's balance out everything. No one particular things become a hero. You can put a 3 hero also, like website also. Website also you can have a 3 banners. In one website also you can have a 3 layers into it. So you can, it's all about how you are mixing the content, the communication outside. Because we don't want that, every day, 365 days, you'll talk about only cataract, cataract, cataract. So you can obviously, do a campaign planning in a such a way that all 3, major this thing have a, balanced approach. Like how we do it in a multi-speciality hospital. For example, say right now we are handling SCG multi-speciality hospital, Ahmedabad, Rajkot, Bhavnagar and Hubli. All 4 locations, we have a one channel only to promote. Hubli audience is different, Rajkot audience is different, Ahmedabad audience is different. So how we are doing it? We are doing the entire, content planning in a such a way that understand the local niche also, local requirement also. At the same time, every doctors, every department gets his pie on it. So that's how we need to do it. Yeah,
Thank you, sir.
AP, who is AP? I don't know. Just we are saying AP is raising the hand.
Yes.
Dr. Anand. Okay, so I wanted just a query. Basically, when we are speaking to the people with the marketing agencies and we are deciding what area we want to focus, and there would be competitive hospitals with similar niche. So we have identified the niche, but we realize that there are other people also doing the same level of niche. What has to be the message? Give me 4 points that can differentiate your content in the same niche.
So first of all, you're yourself first. You are the first unique person. Your way of communication, your presentation, your look and feel it would be a different than other. ऐसा तो नहीं होगा कि एप्पल का स्टोर और सैमसंग का स्टोर एक जैसा ही होगा. Both have an Android, both have a this thing, like for example, say I'm just putting a, this thing, that, but they have some other thing at the second time, like location. ऐसा तो होगा नहीं कि रोड के सामने की साइड और बाजू बाजू में आप लोगों का है. So the location also is there. Then the demography and geography at the same time, your pricing. Maybe there would be some kind of pricing game would be there. I don't know. We need to really look into your particular case, but there would be a differentiate. If you go deep dive, you can definitely have something different. एकदम apple to apple नहीं होगा. Service is apple same to same होगा. But there must be something which will be your differentiator. Mohammed, if you wanted to add.
Elias, when we are speaking to agencies who are doing this, what are the 4 questions we should ask? Akhil sir, same question to you as well. What are the questions that we should be asking them or directing them?
See, basically, as I also concur with the initial point of having your personal brand. The problem is mostly the personal brand communication does not happen to agencies, because the doctors themselves see that the product, the service outcome is commoditized, which is not the case with. From the patient perspective, they are coming to a brand. A brand is a defined set of ideology they have about the particular place, organization, or anything for that matter. So they are coming for a brand, and what they get is a branded outcome. On the other side, a doctor should also know that it is a branded outcome which is getting delivered to the patient. So that awareness is missing at the doctor level. So whenever the communication happens to agencies, more than the personal, your information is not conveyed to the agency. It is only the actual outcome of what gets delivered is conveyed. So at that level, your doctor profile communication or your persona communication is very, very important. Apart from that, as Akhil said very rightly, every region has certain metrics to really leverage and play. Certain things work very differently in certain regions, and certain things don't work in certain regions. In certain other regions, I have seen, simply because the doctor speaks in a minority language, which is appealing to that particular minority segment, the doctor gets more appeal. I have a simple example here. There is one location in Chennai, okay. In that location, the Hindi-speaking population is very high. And the doctor there is a Hindi-speaking doctor, and the kind of traction he's able to build is very, very high. You don't speak Hindi, you don't get Hindi-speaking population in a very huge numbers. They are usually spread across, okay, in Chennai. But in that stretch, there is more. Simply because the doctor speaks Hindi and there's a good leverage, this doctor has more prominence than others. So likewise, there are certain indicators basically that can be leveraged. So when he's creating content, we purposely tell him to create in Hindi. Even though the majority understands Tamil, but the minority who understands that the Hindi language here, who are his actual target audience, the loyalty and the engagement rate is far higher than the other language that he can speak. So if you can actually find such threads, this is really going to be very, very nice. And another important thing is that, you all have been asking about this one thing. We do multiple things, but how do you focus on one thing? Or we have to, as Akhil said, you have to compartmentalize or, create a calendar which gives importance to each one of these things. But also know that if you are a specialist in one thing, or if you are known for one thing, you may do other things also. It is not necessary that you don't have to do other things. But if you are known for that one thing, it is easy for you to earn the trust. That's where I have been showing the examples of, Dr. Rela talking only about liver transplant, but it doesn't mean that he doesn't do other things relating to liver. Or the hospital is a multi-specialty hospital that does so many things. So what happens is, when the brand positioning of one person on one thing is very clear, trust is earned, and with that with that single element of trust being built, then you do anything, it's actually okay. See, the Dr. Balarajan is one thing. He talks about robotic knee replacements. It doesn't mean that for every patient who comes in, he will do knee replacement surgeries, that robotic knee replacement surgery. Not at all. For some people, he doesn't have to use robot. There are several cases they don't even need surgery. There are a lot of things basically. If you are known for one thing, people will trust you. Then you do several other things. It's okay, because people can understand, process very limited information. So they have to. You can give them only one thing for you to be known. Another example that I have seen is, there was a doctor I was interacting with. and the doctor is known as a well-known cataract surgeon, but the doctor is a specialist in oculoplasty. Doctor says, I want to do oculoplasty, but people who come here are coming to me for the cataract surgery. See, here the interest is on one side, but a doctor is famous and known for something else. And the kind of revenue that they are building, more than 80% of the revenue is coming from cataracts only. So it's all about, sometimes when you are in a market naturally known, or through your efforts, people recognize you for something, you leverage it. Then you do anything and everything that you want, and simultaneously you can build everything. But you don't kill it. That's very important. The moment you can understand this part, it's like, sell what sells more. And it is very easy to sell what sells more. But people, the biggest mistake that a lot of small and mid-segment brands do in every segment is that they think something which is selling is already selling. Why should I sell more? But the formula is, if you sell anything that sells, that actually sells and sells more, you will not have problems and complications. In fact, you will be a leader in the market in a very short duration. So actually, that is the real success. And that is very easy and it is granted. And how do you know it? You just have to analyze your last 3 years financial statements. You will know what surgeries you have done more. And that is actually your niche in a way. It's financially
One more thing, a question for both of you. When we are taking, let's say, a promotion for LASIK, let's say in summer holidays, what are the questions that we need to answer ourselves to design a marketing campaign like this? Should it be price based? Should it be experience based? So that is one query, because commodity, something like cataract and LASIK is almost like a glass now in terms of pricing, because people are looking for pricing. So when we are creating a product, a campaign for specific niche, should it be price based? Should it be personality based? And what helps you take the decision?
So basically, sir, if you are you there during the customer persona thing we talked about?
Yes, I did attend that. Yes.
Okay, so basically, if you remember, what I talked about is that before doing any marketing activity or any promotions, we need to understand two things better: brand persona and customer persona. And if you are done with your customer persona, your answer, that whether I should promote the price, whether I should promote this or whether I should promote this, that answer will give you customer persona, because you need to understand what exactly your customer, your niche, your target crowd is looking for. They are the price sensitive, they are the emotionally full, or maybe the wanted to convey the USP thing. What are their need? What is their requirement, and how to reach them? What are the basically campaign is equal to budget also. So you need to see how much budget you are having in hand. Are you going with the 360-degree or only a Facebook or Google advertisement? Then you need to see the competition also, that in your particular this thing, competition are doing what, and what X thing you can do it. So there are a lot of questions you need to ask yourself first, and then you can derive, okay, this would be the base strategy.
Got it.
And before that, because we were talking about the, agency and all. So from last 2 weeks, there are a lot of people who are asking that, why don't Ophthall can come up with some kind of, package or, this thing that, because a lot of people are struggling about the, agency thing. So you won't believe, me and Mohammed had a word also, and we were planning to design some package for you all. But unfortunately, we couldn't do it because there are a lot of questions to be asked. A lot of questions me and Ilyas was struggling to understand. So meanwhile, what I've done is I created the entire blog, that how to select the, the agency. And due to my travel, I couldn't finish it. But what I did is, मैंने copy paste करके group के अंदर भी डाला है और ये chat में भी डाला है कि like must ask questions. Basically, must ask questions before hiring an agency.
Got it.
Have you worked with the doctor, clinic, or hospital before? Can they showcase their case studies with the measurable growth? Do they understand healthcare ethics and NMC, ASCI basically Advertising Standard Council of India. PBI is basically Press Bureau of India, marketing norms. What is their process for strategy? मीन्स वो स्ट्रेटेजी है कि खाली पोस्टिंग करते हैं या फिर कंटेंट बनाते हैं. How do they track the leads and ROI? Is there any pamphlet or any particular format they provide on a very first time, like okay first month में हमारा ये होगा, ये होगा, third में ये होगा, and red flags basically कि जो लोग बोलते हैं ना कि we will post 30 posts, we'll have a 15 post in a month, we'll have a 15 videos. So you need to understand खाली आपको creative content ही चाहिए posting करने के लिए या फिर आपको measurable growth चाहिए. No access to analytics and dashboard. We talked about a lot of analytics, search console and meta and all the stuff. कि वो measurable देते हैं कि नहीं देते हैं, उसका access आपके पास होता है कि नहीं होता है. Every client gets the same template जो already I think अमित सर ने बात करी ली. And no performance or consultation call on regular basis after the onboarding. ये बहुत ही ट्रिकी चीज है. होता क्या है, ऑन बोर्ड हो जाता है, सब कुछ हो जाता है और उसके बाद एकदम से गायब हो जाता है. फिर सडनली आप जब उनको डांटोगे तो सडनली उनकी टीम आ जाएगी और आपके साथ बात करने लगेगी. दैट शुड बी अ फिक्स प्लान. लाइक रेगुलरली एक आपका गूगल कैलेंडर में फिक्स होता है कि एवरी सैटरडे 3 to 5 इज योर कॉल विथ योर एजेंसी एंड 1 वीक में क्या हुआ दे विल लेट यू नो, और मे बी 15 days or once in a month. Every agency has a different rules, regulations, but you need to see that how frequently they are doing a consultation thing. So these are the points. Yeah, Mohammed, you can continue.
And also when you have an agency, see, the digital world is also very, very complex. I think Nutana Saifam, I think, maybe you can keep it on mute. It's very complex and every day a lot of things are happening, and you just sign up with an agency and you want the agency to do everything. Even if all the resources in the agency work for you as one single client doing everything, even the resources won't be sufficient. So it's very important for you to really understand what you want to do in digital. Basically today you don't have to, there are a lot of things to do. Okay, there are certain things which are mandatory for you to do, but there is like only one thing initially you can yourself also fix up in doing, which could just be starting Insta or sticking onto YouTube. You can just pick up one of these two platforms and you can just get started with only one thing. In that way, what happens is your conversations are very, very focused with respect to what you're asking the agency, and our agency delivering the service is also very standardized, very accurate, numbers are very clear. It actually, most of the time, the problem is what, it's a problem on the other side also, that's from your side, because you are too busy and you want agency to deliver it, you don't know what they're delivering and what you are getting. That's actually a very big gap. So in order to, bridge that gap, what is required is you have to take the agency relationship stage by stage, wherein you take up one particular assignment, you sign up with them, you get the deliverable, then you build a trust with the agency, you understand their working culture, they understand your working culture. It's actually a perfect marriage that needs to happen. Once that happens, then you see there is a output that comes in, and then you start signing up for lot of other things that the agency can do, and your work is very much minimized to, as Akhil rightly pointed out, in only looking at those pointers which you should be taking control of or hold of, looking at the dashboard or those indicators. So, and most of the times, the real failure happens because the client is not able to contribute that time. So it's a time commitment which is required, maybe weekly once or 15 days once or monthly once. You definitely have to shell out some time with a defined goal, with a predefined goal and a predefined result. This month, our focus is YouTube. This particular number of subscribers we are planning to increase or add these many videos on this. This is the calendar we are planning to work. So all this needs to be decided much before, and during the review, it has to be a very, very drilled down, very focused review. Then it saves all your time, and we're all happy with the kind of the growth that you're having. Over to you if you have anything.
Lovely, Ilyas. One just question. Based on your experience working with multiple doctors, both eye and non, and of course I'll get Akhil's input as well. Tell me 5 things that you feel that the doctors can improve or are not doing, which would help to develop the growth. Just 5 things which you feel would help.
First thing is that I see there are a lot of doctors who have accomplished a lot of things. First, the communication is not coming out from them. They would have got awards, accolades, done very nice presentations, case studies. All these things come out, once after a 6th month or 12th month, they say that In this year itself, I did this particular thing. Then what's the point? You didn't tell us all these things before itself. Actually, they are so time crunched, or because of whatever reason, they don't talk about these things. So first is that they should communicate in a very clear crystal term. There are formats through which they can communicate who they are, what they have done over the years. So
Got it.
be very clearly done.
Okay, what else?
Number two, where they want to go. Again, there shouldn't be confusion. I want to do this, that, and all that as well. No, that's not going to work out. So for that, either you have a management consultant who gives you the direction, or you yourself have clarity, or you talk to an agency and you get clarity on, this is what I have done and this is where I want to go. Third thing, and for going there, I have these things, which could be technology, which could be people, which could be, your marketing budget. Now you have all these things in place. So that all communication should also be given to agency, because sometimes the agency will plan a campaign. There has to be a follow-up which has to be done by a counselor, and there has to be a closure which has to happen. That will convert your OP to IP, make your OP to IP. So the third thing is, the team explanation which has to happen. Fourth thing is that, consistency. So a lot of times all these things are planned, but there will be a miss in terms of consistency. So for that, to keep up the consistency, there is a routine which has to be fixed. And the fifth thing is that, review and with the analytics, because all efforts put forward, the doctor should be there to understand the review when it is explained by the agency, or understand it on their own through the initial learning sessions that they may have.
Got it. Got it. Thank you. Thank you. What about you, Akhil?
So there would be a one-liner only, which I practiced when I entered into the entrepreneurial journey and started my 3 companies. And I and my partner Neeraj, we strongly believe and strongly follow that thing. And we do it before signing the contract. Before, it was like, very first day we do it with the doctors. And that is one-liner only. The doctors, you are trained enough to do your job, like whatever you are a surgeon, you are a doctor or anything. We never ever interfere in your practice, that how to do a cataract, how to do a LASIK. So please ensure that you will not interfere and you will not teach marketing or a branding to us. You need to blindly trust on us, like your patient trust on you, that कि आप cataract करते हो तो patient आपके ऊपर trust कर देता है कि they are the best doctors. The same way, if you are hiring me or as my company, as an agency, then it's like, before signing the contract, no negotiation into this, that you need to trust on us, blindly follow us, then only hire us, otherwise don't hire us. So this is like, one-liner. It's sometimes it roots, but this is like, very clear-cut communication on very first day, that we are expert into this and you are expert into this. Whenever it comes to a medical something, we'll ask your suggestion, and you definitely ask, suggestions and everything, but don't interfere into any agency's work. Blind trust them.
Got it, Akhil. My question was more respect to, based on your experience, what are 5 things either you feel doctors are doing less or need to improve on, was my thing. Just like
yeah, that's true, but I think Mohammed had already covered all the points.
Thank you. Thank you.
Sir, I'd like to add one point. We had worked with multiple agencies. They overnight agencies, what they do, just what you have seen, the red flags. They just post Facebook's post by keep on changing the wordings and the pics. But what Mohammad Ilyas says, we don't have a roadmap. Okay, we are busy. We cannot suppose give time. The issue is we don't have a roadmap. They don't provide us what to do at what time. Suppose you give us the roadmap. This is this month we have to do YouTube videos, but what we have to talk on that videos, we must be knowing. Most of the time we are confused. We want to post, but what to post? Like today's cataract.
Don't work with that kind of agency who is not giving you this kind of thing. They are
Like,
not right.
Sometimes we were also thinking of what to talk. Suppose we have post one on cataract. Second, suppose type of files. Third, we are empty. We don't have any topic to put content on them.
Right, sir. Absolutely.
Okay.
So,
Yes, you added that. Yeah.
no, that's what I was telling, sir, that, in that case, definitely you need to talk to your agency that these are my expectations, that I need, very prior, like 3 months content you provide, that what to speak.
Exactly.
3 months content calendar you provide, that when will you post what. So it would be, peace of mind from your side also, and whenever you get time, you can generate the videos also.
So what I do is, as a practice, basically what Akhil was talking about, and what we do is, the moment we do the onboarding of a client, we do a client onboarding call, basically. Okay. In the onboarding call, what we try to do is we first want to understand what is your goal for the next 1 year with respect to these specific digital mediums. We start understanding their goal, and based on their goals, then we set the benchmarks. In 1 year in the digital space, you want to be here. For that, these activities have to be done, broken down into these many months and these many weeks. So once that is broken down, there is a calendar which gets prepared, as Akhil was trying to talk about. Now, every 3 months, there is a calendar that is prepared. And for every quarter, there is a progress and there is a benchmark set. And all these goals are aligned as this thing, the calendar is aligned as per the goals. And then this 3 months, every 3 months, you will know what is happening at an overview level. So basically this month you're talking about it, next month you're talking about, next month entire year you are fully having a bird's eye view on the content. And then for the next 1 month, what exactly is going to happen, which day, which post, which time exactly, what kind of content is going out, even that is mentioned. And that whether it is a static post or a video, that gets defined before itself. And we started this practice off late, wherein we create a calendar, we set everything. But in between, what we do is we started something called as a trending video bite kind of stuff, wherein we keep watching the trend in each region for every core specialty, for any, even for example, for a cataract, if supposing. And if you are following those trends anywhere, and we are able to find one interesting content is becoming viral, we immediately take that content and we make a topic out of it, and we start passing it on at the need basis. So you can't plan such things before itself, but you know that it is aligning with your goal. It is very much in relation to what you are doing. Then immediately the content has to be made ready immediately, and then it has to be posted to just keep up with the trend. So I think having an overall goal is fine. At the same time, having the calendar is also fine, but make sure that the calendar is little flexible, aligning with what is currently happening now in your region or nationally, so that you have an immediate audience coming. Sometimes those videos actually go viral. Okay. Dr. Sahiba Bedi.
Yes, hi, Mr. Ilyas. Apologies, I joined a bit late in the class. I'm not sure if this has been covered, but I wanted to ask you and Mr. Akhil. For example, if I don't have a center of my own and I want to create a personal brand, is it permissible by the NMC to create a name that I can endorse as my brand? For example, not under my name. I'll give you an example. For example, a dentist has a brand called Smile by Dr. XYZ. So, is that permitted under NMC? Can I create that brand for myself and create a profile online and post social media content on that, or is it not permitted as per a doctor's profile is concerned?
Can I answer that? So
Yes.
basically, I think you want to try to create an additional brand. For example, Smile by Dr. Sahibab. What you more than the NMC, I think more important is the trademarking of the brand. Because
Right.
I don't think NMC has any opposition for you to create a brand. So you have to protect that brand. For example, let's say it is what do I say? Perfect LASIK or something like that. So
Yeah. Yeah.
first thing is you have to trademark that name so that you can lay claim to that name if somebody else also uses it. And
Right.
then you can start promoting it. But only problem is, yeah, personal brand. But I think Mr. Elias will also say better to create a personal brand in your own name rather than having a sub branding for that. And once you start your
Okay.
own center, then you have the brand for that. Maybe Elias can add up to this if he is also.
Actually, just I wanted to show you one slide here.
Yeah.
These are some of the very popular influencers out there. So it's there in my list. I'll just show you. You see here, some of these are not actually the names of the doctors. They picked up some niche. This is the name of the doctor. Okay, Bachon ki doctor. So you see the tag
Yeah.
is Bachon ki doctor. So if it, as long as it goes with you want to go with a name or you want to go with some of these titles which comes up with a message, I think all that is very much there for you to see. Dr. Pimple Popper.
Yeah.
If you can actually boil down to such thing, a single focus only on one particular area and create something catchy on that part is also good enough for you to look at. And this is not something, as long as you're doing only awareness and it is going to help people, any name that you have which can help people to connect with and get the awareness message from you is good enough.
Okay, and not just from the social media point of view, I also wanted to know, for example, I create a brand for myself, and later on, if I want to do a collaboration with another sort of medical center, which might not be only eye center, for example, any dermatologist or any dentist. So in that aspect also, I wanted to know that do you think creating your own brand is safer, because later on, I have that flexibility of collaborating or coming out of that also. But if I go with my name, or will going with my name be better, just for marketing and creating a little more attention, which one would you suggest to go? Because obviously creating a brand has more work to do. It's simpler to just market yourself as your name, but then again it's a little more attention
Say, for
gathering.
example, if you're looking at building an organization and having a setup, then Clinical
Yeah.
Establishment Act and all these things come into picture. It's not again we have to be very specific. Are you creating a brand only for awareness sake, and then you want to collaborate with other organization and just be an awareness provider, or it is going to be an organization that is going to be there in a physical place wherein you're going to do the practice, and then
Yeah.
these services are going to be available by another organization that you're collaborating. Then it is a pure practice setup kind of a thing, which Dr.
Yeah.
Sindel can help you more in detail. And then it is a practice setup basically. So it's a physical setup, then it is a separate
Yeah.
subject altogether, wherein you build an organization like any other, and then you can do whatever you want with the organization.
So branding will help there more, right?
That's the organizational branding we've been talking about from the beginning. Yeah.
Yeah.
Actually, what Elias has been telling is like, along with your name, having a catchy name which will relate
Yeah.
to people more. That is not, there is no need to have like a trademarking for that. I think it's just to relate more, like spectacle killer, something like that. If you are a LASIK, so you cannot brand that. That is to relate more with the patients. But what
Yeah, more for social media.
is, if we are creating a very strong brand, like say Infinity Vision, Dr. Sahiba. So that Infinity Vision, you also want to continue as your practice name. Then you
Yeah.
need to trademark it, protect it, and all those things. So these are two.
Kalyan, okay, sorry. Dr. Kalyan and Dr. Ashwini wants to.
Yeah, yeah.
Yes.
Dr. Kalyan can go ahead. Yeah.
Hello.
Yeah, please.
Sir, this is a question to Elias, sir. I think he has some part of the presentations to go through. I think he had gone through focus, and there were a few things about the checklist for the schedule, and I think because we kept on seeing it in between, but with the flow of questions, it was lost. Like, it's a kind of template for a calendar, or a rough idea of a calendar. So if you have time and it permits, you can just run through and complete.
Yes, yes.
Can we
Please, sir.
take
Thank you.
Dr. Ashwini's question and then go?
Yes, that will be better. Yeah.
Sir, I have one simple question. Rahil is one of my Rahil is junior to me. So once I asked him during ARS Kolkata conference, here I want to create. So he also said the same thing. Boss, just focus on one thing. So I started my YouTube channel, which I have now 300 videos, small, daily basis. I'm putting 1-2 videos, and in the process I learned many things. Now the views are getting 200, 350 views, but I am putting on a regional language, like Odia, because I am from Odisha, so I'm putting in Odia language. So I am not sure whether I should put in a, because I'm from third tier city. Because in Delhi, for I7, the people might see in Hindi and go to Delhi for operate. But to come to my center, I think I have to catch all of my region, my area. So I'm putting my content in my regional language. What your views and suggestions regarding that?
That's actually a good take, sir. You should actually leverage on your region. And another thing is that, even your dialects, the way how you speak, all that really matters. Even, for example, in Tamil Nadu, Tamil is spoken little differently in certain regions. Simply because of the way how people talk, the particular dialect of Tamil, there's a very good affinity with the local audience. So actually, that's a good thing to look at. So you can continue doing it. Apart from doing that, there are now a lot of tools available which can translate your content in other languages, which may be immediately related.
Recently I attended one AI class where they said okay, they put subtitles in English or Hindi that will keep more view. So now I started putting that content I'm speaking in Odia, but I'll putting something on Hindi, the taglines or few words. And they said that many people, the viewership shows, many people watch it in silent mode. Many people watch in silent mode.
Exactly.
So,
Right.
so that's what I came to know recently. So now, from now on, I'm trying to do that. Thank you, sir.
Actually, you can build 1 million or 2 million user base in Oriya only, in Odisha only.
Exactly. That is more easier.
I don't know, sir. It is like 2-3 years. I have put in maybe 300 videos. Maybe I have 200, 500
You have
subscribers.
to identify the target market, what they like, and it takes time. And I think we don't have to copy or think what Rahil is
No,
doing.
last time Sir said only, okay, not only post educational content, you put all other things like if you are going to a gym, you are a fitness freak, or if you are going to. Recently, Riley went to Los Angeles and he is constantly putting that his status. He is there.
Yeah. So I'll tell you. See, basically, first thing is let us not trying to adapt to what Rahil is doing. It may not be.
Yes. Not equal to us.
Yeah, so what the strategy which he is trying is three. One is like he will have reels which are focused on his target audience, like new followers. Let's say he wants to collect new followers, he will put those reels focused on cataract, LASIK, smile, silk, and all these things. Second thing, along with that, he will also be putting some of his personal things like going to Los Angeles, going to Mount Colorado, all these things. Basically, that is for a set of followers who are already following him. So he wants us to follow his life, basically. And third thing, sometimes he might also get a spiritual and put some motivational quotes and all these things. So these three are very different. So to get new followers, new people into your loop, you have to put some reels. And your strategy of doing it in Odia or that or language of Orissa is very good because that you will have less competition in that. How many ophthalmologists will be putting in Odisha language? So there will be very less, but you still have millions of people in your own language who will follow you slowly. Okay. So keep focusing on what you are doing, but maybe the content, are you kind of, is it interesting for the target audience? I think you have to see that. So we will discuss. I think Akhil has something to say.
Sir, just one request. I need your permission. I have some work, so I'm just going.
Yeah,
But keep in touch with everyone at group, and definitely anybody wants to. So through you, we can definitely connect. And sorry, boss, Elias boss.
No, thanks. I think we should all thank Akhil because
Thank you
for the
No.
trying today. Yes.
he has
Okay.
done excellent.
No, but thanks a lot. See you soon. And Mohammed, you can carry on. You have a lot of things pending right now. So let's not talk much about it. See you soon. Bye-bye. Bye, sir.
Thank you very much.
So we can continue for another maybe 10-15 minutes and wrap it up.
Yeah, we can do that. Yeah. So I'll just talk about few tools actually which are there, and with that, let me just conclude. Is there the part of my presentation? So I recommend, and I believe, is my voice clear?
Yeah.
So I recommend, creating what Dr. Sendil was talking about, creating reels, focusing more on reels to get immediate visibility, because creating a reel doesn't require much of your brain work. It requires you to just give an answer. Less than 30 seconds is, it can even be 30 seconds, less than 16 seconds, can even be 30 seconds, 40 seconds, 10 seconds, 20 seconds, sometimes. Content creating, so less in duration is very easy and it gets you more reach, and it helps you actually build consistency. That's where we are talking about. These are some of the tools that I've been using, and I recommend you to use these tools. One is this tool called 11 Lab. All this should help you, in keeping up with the consistency part of it, wherein you can type the text and you can get the voice output from here. And you see this tool being used in a lot of places. The good use of this tool is that you can clone your own voice. Just have to upload 1 minute of your voice and it gets your voice cloned. So when you are not able to produce content at that time, you can actually use 11 Labs where your cloned voice is already there and you can just keep getting the content out.
Hi, I am Mohammed Ilyas. I welcome you all to FCR Hospital Marketing Framework
So
Workshop.
you were able to listen to that, right? You were able to hear that?
Yes,
Hello?
sir. Yes, sir.
Yeah, you were able to hear that, right? So that was my voice, cloned voice. So you can create any type of sounds you want. So first, my recommendation to you is get your voice cloned and keep it ready, and it can happen in any language basically. So it supports more than 100+ languages. That's one very important thing. Second is that get your video also cloned. This is my video.
Hi,
cloned.
I am Mohammed Ilyas. I welcome you all to FCR Ethical Hospital Marketing Workshop.
So like this, I can talk in any language.
Namaste, मैं मोहम्मद इलियास हूँ. मैं FCR Ethical Hospital
You're able
Marketing
to see there is
Workshop
a
में आप
lip
सभी
sync
का स्वागत.
also with expressions and everything.
वणक्कम என் பெயர் முகமது இலியாஸ். FCR Ethical Hospital. 안녕하세요. 저는 모함메드 이리아스입니다. FCR 윤리적 병원 마케팅.
This actually, all these are my cloned videos, and I just created only one version of me, and then I made my version, talk in any language that I want. This actually helps you in a very big way in the medical tourism, and also to appeal to your, minority segment within the same region. There are some languages that only very few people talk in a particular region, and if you see that there is a strong following of patients from that particular region with using that particular language, you can actually build a deeper regional bond there, or you can even operate a separate channel wherein the content is same, but it is in a different language. You produce content in only one language, then on all other languages or in other language, basically it is all done through your AI model. So it is done through a tool called Agent. This helps you in building your own avatar, and then with this avatar you can actually get the content out. Now they are giving a free avatar. I would request you to make use of this free avatar and create once your content, and then see how this thing goes. Second, the next tool that I use is this clipping the tool kind of a tool which helps us to get a long form of content. Like for example, I'm not talking about branding or a lot of things here now. If supposing it's a 1 hour video, I want say 15, 20, 30 different clips of this entire video. Then just I have to do is, I have to.
How do we do it?
This is how the output comes.
The moment I talk about.
I gave this video, which is a 14-minute length video. It gave me 1 minute video, which is fully edited. So if I were to give it to my agency guys to do the editing, it is going to take say half an hour, 1 hour, or 2 hours based on the skill set of the person. But this tool gets the entire video edited in a portrait format with the subtitles, everything done in just 2 seconds. So the tool name is called Opus Clip, and there are a lot of other tools available. We just experimented with few tools wherein we found that these are really trustworthy tools to go for, because there's a lot of scam happening in the AI tool space, which is not really good. So even if there are 2 people talking, it clips the video accordingly. Another tool is called Gravity Write, which helps you to write different types of social media content or SEO content, YouTube content, all that. Even if you are not an expert in this advertising space, this itself will give you different prompts, like shorts and reels creator. So even there was doctor was asking about we don't have ideas on how to write the content there. So you don't really have to write today. Only thing is that you have to deliver. So the written stuff will be done, but how you deliver is what makes your content unique, and that really sets the tone. And from here you can actually just type the content that you want, or the topic that you want. This itself will create the script in the right way, with the right pitch, the right hooks, and you don't have to do much. So ChatGPT, is being used for several things, and now it's becoming much more stronger with all the other tools affiliated with ChatGPT. There was a doctor who created a entire song. Dr. Hari, I've been playing this in a lot of Ophthall conferences. Then he created an entire anthem talking about this particular organization, and also the some health advices relating to eye. Sorry. Excuse me. So with these tools, we even create conceptual images which are very difficult to even get it from outside, from any stock bank. But all these images are free of cost. We did a lot of work. So a lot of these images for social media also you can generate and make use of, which are conceptually correct. Very interesting to really look at. And there are tools which even give you the freedom to even make the text images into videos.
Insect repellent is the best.
So these things are available. These things are almost there for us to use, and just requires very little efforts to go through it. There's a tool called Runway ML, which is doing a fantastic thing. And there are website tools which are now available through the website builders, wherein you just have to give certain commands and it helps you build the website. Of course, it requires, initially it may be difficult for you to sit and dedicate time. If you have time, you can definitely do it. Or you can give it to someone and help them create a website for you. Even someone who's little qualified to handle certain things or dedicate some time to get the website. And these websites are now becoming very, very popular, wherein few prompts are given in few minutes, the websites are getting ready. But again, it requires a little bit of fine tuning with some expert help so that it is fully ready to go to the market. It cuts down a lot of your time in building a website. The last part is the topic research. We also got this query, what topic to talk about? There are tools like this called Answer the Public, which helps you to know what is really trending today on that particular topic. So it is for cataract. Under cataract, there are these many questions people are asking. Only thing that you have to do is pick up all these questions and create answers for them. Whether you have a text-based answer or you have a video-based answer, you just have to create answers for them. Even if there are other brands who are going to create answers for them, let them just create. It's all about whose answers are going to be more accurate, more appropriate, more meaningfully connecting. That's what really matters. And then you can also go to ChatGPT asking for questions, answers, and all that stuff. And then this is a very important tool, which is a much forgotten tool called Google Alerts. You just have to go here and type basically whatever topic, say for example, cataract. And once you subscribe to this particular tool, which is free of cost provided by Google, it's been there for ages. And it gives you every day, what are the trending topics on that particular thing. So relating to cataract, if anything is happening in the world, any advancement or any kind of news coming out relating to the word cataract, then it will flash you in your, you'll do all the research, pick up all the news and deliver it in your email box. You just have to go through that and you have to pick up the content from there. Google Trends is another interesting tool. YouTube filters are very important because this itself tells you what people want to watch. And there are certain contents like, even if you do create content on the same topic, hundreds of videos, still people will want to watch that. What this cataract can be a very simple thing which, a lot of people can create content on. Still, if you are going to create content, there are going to be people who are going to watch it. Okay, and if it is going to be a regional language where not many people have created content, again, there is going to be a very big market that you're going to see for that. Say, for example, there is this tab called News. This is again an underutilized tab. Usually people search here in the Google and then they only go through this all tab. There's this News tab which actually can get you the latest trending stuff on that particular topic. Say, for example, it says probe against Kolkata hospital as patient claim infection post-cataract surgery. See, we don't have to talk about what has happened there in that hospital. We can actually pick up this theme. Infection, what are the infections that can happen post-cataract surgery if it is not handled well or whatever. Supposing that can become a topic and people want to know about it that particular time. That becomes a trending topic for the timing, and you can actually get those topics from here. There is no better way you can actually create better content without listening to your patients. Sometimes there are some very region-centric issues which are very common. So through your OPDs, you can, by listening to your patient, you can get fantastic content. And we saw this with one hospital, basically. They started creating content for IVF-related thing. They started, it's a very, very tier 3 location, and they have more number of YouTube subscribers than the topmost IVF center in that particular state. So you see, how they do content is a very interesting component. Every day, whenever they get OPs, a doctor, apart from attending the OP, they also have one pen and paper next to them. And once they start attending the OP, they find something very interesting in that OP. They start making a note of that, which could be, a patient talking about a particular medical issue or whatever. They use a particular medical term without even knowing what it is. They make a note of that particular medical term, and then the next video will be on the topic. So what happens is that, it creates more relatability with the immediate audience, and the brand is a big success when it comes to the social media space, especially the YouTube. So another thing is that, create a dummy account and then play around in the social media, see what others are also doing. Sometimes there's a format going out there which is common among all your contemporary brands, regionally, nationally, and you don't want to play with your account to see what is there. So you create a dummy account and you see a lot of these things, and then you do social listening through different tools which are available, and then you get fantastic ideas from reviews as well. Not only your reviews, but also the reviews of your other brands, contemporary brands in that particular point in time. So these are some of the AI tools which you can use. So that's it from my side, and if there are any questions we can take and then we can close. Dr. Ashwini wants to ask something.
Yeah, we can take up 1 or 2 questions and then I think we can wrap up the session. Dr. Ashwini, you have a question? I think he doesn't have a question.
Okay.
So, yeah, I think it was a very nice kind of a session, and almost 2.5 hours we have passed. And thanks, Mohammed Ilyas sir, for all the support to Ophthall and the ophthalmologist. And very nice. I think whatever you discussed, so many practical points have been discussed. And even if doctors who have attended can implement a few of these, I think that will be more than enough. And please do communicate through WhatsApp group, and I'm also working out with a plan with Mohammed Ilyas.
Sir, what I felt is like while going through these classes and this marketing, finance, so what you used to tell, yeah, I not possible for my part being a doctor to deliberate all these things. So as Sir said, once they sign for a doctor, you are master in your field, do your duty. We are master in our field, let's do our duty, because I have to trust somebody to start doing that. But finding that trustable person is most important thing to do the marketing part or not. Because I cannot do all these things, AI generated things, Opta.
Yeah, yeah. So what we are trying to say is these are all the things which are available.
Yes,
And
yes, sir.
it's not possible for doctors to do these things yourself. That is when we get the help of professionals like Ilyas and Akhil Dave. And we are actually working out on a kind of a model for all our participants. I think before the end of the month, we will be floating it out, and whoever is interested to take
Thank
it
you, sir. Thank you.
level, you can definitely engage with them. So that is the plan we are having. And so I think it was
All of you to share your detailed feedback about sessions that we did in marketing. That will also help us understand your feedback on this session, because today is the last day of the month wherein we are completing marketing, and we should start this journey through Ophthall with few other programs, hopefully so. And also we are creating some models and packages, as Dr. Sindhu. Over to you.
Yeah. So thank you everybody, and it was a full attendance today. Almost every participant has attended today, and thank you for being here, and wishing you all the best, and looking forward to meeting you in another session. Thank you, sir.
Thank you very much, sir. Thank you.